A girl had reduced remal height following trauma and underwent a surgery for it with a costochondral grafting. She reported to the clinic after 4 months with a complaint shown in the figure. What could be the clinic? What could be this clinical situation? The option over here is deviated chin, facial palsy, excessive growth of the graft, and decreased mouth opening. So let's look at the picture. It's a very good question. Let's just look at the picture and try to understand what are they trying to ask over here. So as you can see, there is reduced ramal height. Probably the region over here where the reduced ramal height is seen is on the was on the right side, for which she underwent a surgery. Sorry, the left side. So over here, if you can see, the chin is deviated to the right side. However, when you look at the patient from this angle, you see that the chin is still a little more centered. It is not deviated. However, this side of the mandible shows a little more. There is more of the mandible that is visible from here as opposed to here. Lastly, when you see over here the OPG, that is the PA view, sorry, you can see that the mandible is extending from here and goes all the way to here, whereas this part of the mandible is straight. Okay. Now, from these scenarios, let's just correlate it with the question that they have given. Reduced ramal height following trauma. That means the patient clearly has had ankylosis. Following ankylosis, the patient has probably would have undergone a form of uh, gap arthroplasty, and after the gap arthroplasty, see, children are of growing age group. So you would have probably, if the patient was an older patient, you would have probably wanted to not have there would have probably been equal growth of the mandible on either side. However, over here, this patient, it is visible that there was stunted growth in one side because of the ankylosis, and now we need to bring the growth of the mandible back to its normal level so that there is equal symmetry on either sides of the face. The condylar cartilage is a growth center in the mandible. Because there was ankylosis, there was stunted growth that was seen. That is why we have probably taken a costochondral graft along with the rib so that there is continued growth of the mandible in that region. So the costochondral graft has intense growth potential. In this situation, the answer would be excessive growth of the graft, because the costochondral graft has excessive growth potential. It has a very high ability to replicate, or sorry, to multiply, and that is the reason why there would have been excessive growth of mandible in this region, because the graft has grown severely as opposed to normal growth. Now, to identify what could be, how to eliminate the other options, if you can see over here, the chin probably looks a little deviated in this region. But like I said, in this view, the chin seems to be a little more over the center, and over here, the mandible does not seem to be deviated. Also, there is no deviation that you can see probably on opening or closing of the mouth. However, this side of the mandible you can see has more growth, and that is the reason that option A cannot be the right answer. In facial palsy, there would be mask-like facies of the patient on the affected side, in the sense that the mouth is drawn away, and you will have absence of wrinkles seen in that. In more than that, there will be opening of the eye over here, whereas you will not be able to close the eye over here. On the affected side, yes, you will be able to close the eye normally on the unaffected side, whereas the eye will be open on the affected side. That is why this is also out. And the answer, that is why, comes over here to option 3. Option 4, decreased mouth opening, is a very insignificant option over here, and it was just put in for confusing you. Okay.